All right, we're going to go ahead and get started. So welcome everyone to today's Open Enrollment Town Hall. My name is Zach Goss, and I'm here with Sean Sheehan and Sven Lindholm, hosting from the Department of Vermont Health Access. And we're joined today by our guest, Gina O'Meara, who is one of our seasoned assisters in the state, and we'll be hearing from her later in the presentation. So again, thank you all for joining us. This is our series of town hall events where we're helping share information about open enrollment and the various options that are available to Vermonters this year, or this coming year, I should say. This will be recorded, so for those of you who are tuning in later or know of people who missed it today, this will be available on our website. So let's jump right in. We're going to talk today about open enrollment for 2022. We're going to talk about how you can get help, and specifically how you can get connected to an assister. We're going to talk about why it's important to reconsider your plan in 2022. And if we have time, we'll also go to some health insurance terminology. The one thing that is not listed on this agenda is that we really strongly encourage question and answers session throughout the presentation. So we want you to ask questions in the chat. The way you can do that is by selecting that question mark on your Teams platform that you can see. You can type in at any point in time and ask a question to any one of us, either the DIVA staff or to our guest Gina. And we will try and get to all those questions during the presentation today. So we'll start by doing kind of a high-level overview and talking with Gina about her experience as an assister, and then we'll go into a little bit more details and allow for some time at the end to answer any of those questions. But again, if there's something that pertains to what we're talking about, don't hesitate to throw it in the chat as we go. So we're going to start with open enrollment and important dates. So when we talk about important dates for open enrollment, we want to think about when open enrollment starts, obviously, which many of you may know it's already started. November 1st is the beginning, the first day that people can sign up for a plan beginning in plan year 2022. So that is underway. The next important date happens in December, and that will be December 15th. December 15th is the last day to choose a plan where you can get a January 1st, 2022 start date. Open enrollment is not over on December 15th this year, but it is the last day that you have to choose a plan that begins January 1st. And then a couple days in January that are important. It's that January 1st start date is when, if you chose a plan by December 15th, you'd be able to start your plan on January 1st. And then January 15th is actually the last day of open enrollment this year. And January 15th is going to be the final day you can enroll during open enrollment for a 2022 plan without a qualifying event or special enrollment period. And if you did it between December 16th and January 15th, your plan could start on February 1st.
That's right. And Zach, and we're really, at this stage, being November 17th and still having about 4 weeks until December 15th, but coming fast. That's certainly the date, I think, for people who are seeing this live should look to. We're excited about the January 15th opportunity for people to continue to enroll, and think that's going to be a great opportunity if you're talking to friends and neighbors and relatives over the holidays and find out that people don't have health insurance or didn't know about the lower costs. It'll give them a chance to get in, not necessarily have to wait until next year, but at least till now, as always, we're encouraging people to sign up earlier in open enrollment. The phones are a little quieter now than they'll be a few weeks from now. I'm sure, as we'll hear from Gina, the sisters Probably less packed now than they'll be a few weeks from now, and making sure that the earlier you sign up, the earlier you pay that first invoice to get your cards in time for January 1st. It's what, like Zach was saying, we're anchoring on those first 3 dates, but January 15th is a good opportunity for people who miss those earlier ones.
Thanks, Sean. Yeah, absolutely. And I think before we move into the next section, we wanted to talk about our plan comparison tool, which is we just wanted to highlight it. So when you go to our website, we have this great tool that you can find in the shopping cart with the shopping cart icon. And for those of you who are looking for or thinking about plans starting in the 2022 calendar year, our plan comparison tool is up to date, and it's a great way for you to see what options you have, what kind of financial assistance you might be able to get, and the different cost sharing options as well. There's a lot of information. You can even dive into the depths of all the plan details right from that tool. So we highly suggest people take a look at that. And we'll probably, this won't be the last time we talk about the plan comparison tool today, but it's really an important factor that we suggest people use when they're making decisions in open enrollment.
Yeah, it's a great place to start, and as Zach says, it's really a good chance to really tangibly see how much lower health plan costs are now than they've been over the past several years. We've been encouraging people, kind of beating that drum for the last few months since the American Rescue Plan, of people that they haven't looked for a while to come look, because the numbers are different. And we are seeing that happening over the first 16 days of open enrollment. There's been more than 7,000 sessions on the plan comparison tool. That's up over 20% from last year. So we're really excited that Vermonters are using this tool and seeing how they can save money, and we're hoping we can get even more Vermonters insured than ever before this way.
Thanks, Sean. So moving right along, we are going to talk about, as we mentioned in the agenda, how to get help, how to get more information. So we mentioned the plan comparison tool, obviously a really key online tool. There's also more information online that you can get that we're going to go into here. And just to help you navigate our website, this is the Vermont Health Connect website that I have a screenshot up here. And there's a Find Local Help tab. And you can see that Find Local Help tab is on the top navigation bar towards the middle. And this is an important tab for people who want to get more information about the details of what kind of assistance is offered in their area, and just more information in general about how Vermont Health Connect works. The second one is the Learn More tab, which also gives you details about how health insurance works. There's resources and toolkits available through this tab. Of course, you can always call us by phone. Our call center is open 8 to 5, Monday through Friday, except for holidays. And we have trained representatives who can even help you enroll over the phone if you want to, but also if you just have clarifying questions, we have representatives who are ready to answer questions for you. And then finally, last but not least, is our in-person assister program. And during the COVID-19 pandemic, we've had to think about whether this is the most appropriate name, because many of our sisters have ramped up their virtual assistance. It is primarily a program designed for people to have that extra one-on-one support during these important decisions that they need to make. So assisters will sit down with customers and look at all their paperwork and really help them go over the different terminology and the different options, and kind of lay out the landscape for them so that they can make the most informed decision and really feel empowered to have some kind of authority over their health insurance. Sean, I don't know if you have anything you want to add before we continue there.
No, I mean, I could, but I don't think anything I could add will be as good as Gina will have to add from the really talking about his sister. So I'm happy to jump right into.
Great. All right, so I'm going to talk a little bit about the Vermont Assister program here, just so that people have a little bit of an overview. Sean and Gina both have been involved in the Assister program for several years, and I have followed to some degree in their footsteps. So the in-person Assister program, again, is a program that has been active through Vermont Health Connect since the inception, since the Affordable Care Act was implemented in Vermont. And we're going to go over kind of what it entails. So this is actually pulled from our website, but just to review with everyone. So what is an Assister and what can I expect? So Assisters are trained by Vermont Health Connect staff. So they all receive training, and they all receive a certification so that they are kind of validated that they've received that training. So certified Assisters have a certification number and an active license number. So every certified Assister through the state of Vermont will have one of these. They're required to have a criminal background check. And like I mentioned, in order to be able to use the Vermont Health Connect enrollment system, they must have passed these certification requirements. So there are standards set that Assisters must pass. And you know, at a high level, they should be able to answer your questions about Vermont Health Connect, and if not, have resources to help point you in the right direction or find the answers for you. And then, you know, just so that people are aware, because you know, in this day and age, sometimes we get a little concerned about whether people are actually intending to help us, or there's some other intent. So how do I spot a scam? You know, Assisters will never charge you for their services unless they're a business, or unless you're a business or individual who contracts with a broker. So most of the large majority of our Assisters do not have any associated fee that would be charged to the individual or family for their services. They're never going to call you directly to solicit you to work with them unless you've kind of outreached with them first. You know, I think they're not going to do kind of cold calls to try and get you to sign up with something and persuade you into something. You know, there may be situations where there are relationships established and they want to kind of talk to you about your options and help you, but this should not feel like a cold sales call. And they're not also going to make unsolicited requests for your personal information, right? So Assisters will only take personal information that's required of you and that you're supplying to them so that you can apply for health insurance. This won't be an unsolicited request. And they're not going to kind of use catchy terms that, you know, like Obamacare card, you know, offering you kind of promises that don't sound legitimate. You know, they're all trained, they know the right terminology. So the language that they use should sound very official.
Yeah, those are great points, Zach. You know, and I think kind of one simple overriding one that I try to follow and we try to get out with our communication, because it's certainly true. There are going to be times if you've established a relationship with an Assister that they might be calling you. There may be times just by virtue of being enrolled with Vermont Health Connect that folks from the Department of Vermont Health Access or our team will call you for one reason or another, and there may be seeing opportunities to be in a different plan or saving money or various options there. And it's always the risk in this day and age of any time an inbound phone call comes that you're kind of expecting it to be a telemarketer. One thing you can do is just look to call back at the published number. And so if you go to vermonthealthconnect.gov, you can see right there that the customer support center number, the 855-899-9600 number, is there. You can ask to call out that way. You can also look to see on the website, I think as Zach showed, this button here where it says in person, find an assister, that goes to the county directory, and you'll be able to see the published phone numbers there to get a hold of, of the assisters that way. So yeah, anytime you aren't sure, it's best not to ignore the call, because they may be calling for a very important reason. But if you have any doubt of who they are, you can initiate the call in the other direction at the published number.
Absolutely, Sean. Thanks for that. So a little bit more about the assister program before we turn it over to Gina. The state of Vermont has assisters covering all 14 of Vermont's counties. So hopefully there's an assister not located not too far from you. They may actually be at an organization where you're already a patient or a customer, which is really the best way to access an assister. We highly recommend kind of starting with places that you already are a patient or a customer, and you may be able to very easily connect to an assister, maybe someone that you didn't even realize is an assister at that organization. Again, we have over 100 assisters statewide, and they're located in hospitals and community health centers and other types of organizations and agencies. Like I mentioned before, many are providing both in-person and/or virtual assistance. It's really the best practice is to call ahead. So using that directory and trying to set up an appointment with an assister and seeing if you're a candidate for their assistance is really the best way to set up time. You don't want to go there and then not have them not have an appointment that day. So you can set up time and they'll get back to you, and you can determine whether it makes sense for the appointment to be virtual or in person. Assisters also help with both plan enrollment and maintenance. So you don't have, you can be a current Vermont Health Connect customer and utilize an assister. You don't have to be a brand new customer. There's a lot of changes and a lot of things that we've talked about in other town halls that have happened over the course of the past couple of years and over the course of the Affordable Care Act that change what options you have available to you. And assisters have been there to help navigate those changes. And even if whether you're new or a long-term customer on Vermont Health Connect, you can use the assisters as a resource. Again, we've got the assister guide that's organized by county here. It's on our website, but this is also the link that you type in if you were to go there directly. And that kind of summarizes our program. So again, we are really excited to have Gina O'Meara, who is one of our all-star assisters from Northern Regional Hospital here. You can hear her in the background. I'm going to put her on the screen so she can introduce herself. And Gina, maybe you can just kind of share a little bit about the organization within where you're located and how long you've been an assister, and then Sean and I will kind of ask you some questions.
Okay, thanks, Zach. So I'm Gina O'Meara, and I am employed by Northeastern Vermont Regional Hospital. I've been a navigator since it feels like the beginning of time. I've been with all of the people that started this, that love the idea of it, and really encourage people to obtain health insurance. A lot of bumps and bruises in the road, but it's been the assisters and the navigators that have actually, in my experience, help people to feel confident that they are able to obtain a health insurance, able to afford health insurance, and able to take care of themselves with a health insurance through any preventative or anything else that might happen in their lives. The assister program, I've worked with all kinds of people. So if you're a part of the Vermont Health Connect, I'll work with you there. But even if you're just calling me to talk to me on the phone, I'm going to answer questions about Vermont Health Connect that you might have. I've been with it for quite a long time. I've trained quite a few other assisters to be assisters, and I'm actually available to anybody with questions that I can help. And if I'm not able to help, and then I encourage all of the other assisters, we'll try to get answers from you, either utilizing the staff at Vermont Health Connect, the eligibility to be able to make happen what you need to have make happen if you're eligible for it.
Great. Thanks, Gina.
Thanks, Gina. Yeah. As you can probably tell, you know, Gina is here to help, is there to help, and that is really what the assisters are intended to do, and particularly around health insurance. So thanks for the introduction, Gina, and I'll kick it off with kind of what you know, just this high level question of what you find most rewarding about the work of being an assister, being a navigator. For those who aren't aware of the difference between an assister and a navigator, assister is kind of the catch-all term, and one of our types of assisters is a navigator, which is what Gina is. So so what do you find most rewarding about the work, Gina?
I think what I find most rewarding of the work is seeing people staying healthy and obtaining the care that they need to stay healthy. You know, insurance is a pretty scary thing, and I feel like people are more comfortable today than they were years ago. Years ago, we didn't have to think about health insurance. You had an employer, you had somebody through the state that just put you on it. And then the Affordable Care Act came and the Vermont Health Exchange came. And people needed to start learning about their health insurance and how it worked and what would work for them. I think the most rewarding thing is just having someone sit down that's told me that there's no way that they can afford health insurance. Go over the plan comparison tool. I am going to tell you, I thought about that because we had other things in place before, but it's one of my first go-tos. It has been made so user-friendly, putting in your household, putting in your income, whether you have access to healthcare or not. Those numbers come within a couple of dollars of what you're going to get towards your health insurance premium. So the rewarding piece is somebody that's just adamant that they can't afford it, to see them actually have health insurance and be, oh my gosh, I can't believe that I can actually do this, and it's something that will fit into my budget. I think one of the most important things as an assister that we do is we help people to understand that they can afford health insurance, and we also help them to keep dollars in their home. And we also ask the question, we get responses, I'm healthy, I don't need health insurance. There's not going to be a day I'm going to need this. And when we ask the question, well, if you're not working, what are you doing? I'm skiing, I'm biking, I'm mountain biking. Do you think anything can happen there? Of course it can. I've had people that have enrolled in a health insurance plan and within a couple of months needed the health insurance plan more than one time, that have come back to me and said, oh my gosh, I can't thank you enough, because it would have been such a debt to them if they had to pay out of pocket for all the costs.
Wow. Yeah, that definitely strikes home to see that. And I'm sure that must make you feel good and some pride to see your work really pay off and really help people's life in a tangible way, knowing that, you know, the lurch they would have been left in if they hadn't come to you the couple months before.
Well, you know, COVID is another thing. You know, I think the greatest thing was we had open enrollment through most of COVID, and ARPA, the American Rescue Act. We had so many people that did not have health insurance, and we went into this pandemic, and I think it created a lot of fear, and people could not believe that when they didn't feel they could afford health insurance in the past, and asking them, come back and sit with me and let's look at it today, and they can afford it. They can actually afford to take care of themselves and not have to worry about that financial piece or any of those bills, and just focus on getting healthy.
Yeah. So that's something you've seen directly with people that have come to you that have looked before, maybe looked at a previous iteration of the plan comparison tool before the American Rescue Plan and saw that they'd get some subsidies, but not enough to be able to afford the plan, or maybe they wouldn't get any subsidies. But you're saying you've had people come in the last few months that have looked at it and seen it really different.
I have. I've seen more than one person. I've seen a number of people. And I also, I will remember people that have different chronic conditions, that once ARPA became available, I reached out to them and asked them to come back and sit with me, or somebody would refer them back to me. It's been more than one person that has actually benefited from ARPA, and I just have to applaud Vermont Health Connect and everybody there for being able to actually make it available and allow people to understand what it is. One of the other things that I'd like to share with people that other people in the rest of the country don't benefit from is, because Vermont has their own health exchange, there's an extra dollar amount that people that enroll through the health exchange get towards their health insurance premium. So people that are on the federal place to get their health insurance, they just get whatever the federal monies is. But if you enroll through Vermont Health Connect, you get another small pocket of money to help with that cost of your health insurance plan, because we have the health exchange here in Vermont. It's run by Vermonters. You're going to be talking to Vermonters. We're everyday people just like you. We get what's happening with you. We understand what you're going through, and not a lot of other states have that.
Yeah, that's a great point. Thanks, Gina. And when you brought up kind of reaching out to the people with chronic conditions to come back after the American Rescue Plan, I was wondering if you were going in the direction of getting them to rethink the plan they were in. I mean, people who were already enrolled, but maybe they weren't able to afford a plan with lower out-of-pocket costs, a higher middle level plan. And was that part of the outreach you were doing, to let people know if they took another look that maybe with the lower costs they'd be able to afford a enhanced silver plan or higher plan that would have lower costs there?
Yes, that's some of what I did. Some of what I did were people that already had the plans that I had been working with, or had voiced to me or come to me and said, I'm not able to afford this, that I went back to, and the ability to be able to change the plans. One of the other pieces was some of the benefits that were people on unemployment were able to obtain health insurance. That was huge, because typically if you're not employed, you're not even thinking about health insurance. So that benefit that was given to people actually reached out to a lot of people that needed the health insurance, that honestly, it was convincing them, yes, you need to sit with me. I know that you just did this, but things have changed. And let me help you take a look at what's available, and then decide whether you still want to be at the thought you were before our conversation. And I will tell you that 100% of them, they enrolled in health insurance.
Wow.
The metal levels are very important, because you can get a better plan at a lower cost because of what the federal poverty level are. And the metal levels help to reduce your deductible. They help to reduce your out-of-pocket expenses and your co-pays. So.
Yeah, that's great. And that's actually one of the pieces too that I think is great. You were talking before, Gina, about how the plan comparison tool, and Zach had shown just clicking on the shopping cart how easy it is to use. But I think a lot of these terms that we all use by living and breathing in this world, things like the federal poverty level, and interchangeably translating the, a dollar income into that, but things that most people would have no idea what their income is in federal poverty level. One of the nice things with the plan comparison tool, as you indicated, you just put in a little bit of information about the number of people in your family and the household income, and it tells you right off, kind of which benefits you you qualify for and shows you which metal levels are likely to save the most money for your family.
It also, I feel, it gives you the cost, but one of the things that I like very much about it is it shows you right up front what your deductible is and what your out-of-pocket maximum is. Yep. So you know right there how much money it's going to cost you to pay your premium, and then how much money it's going to cost you if you utilize the whole plan through the course of the year, or you just utilize a small piece of the plan through the course of the year.
And you would think that we had this, you know, well choreographed, because Gina's actually giving a snapshot of some of the things that we plan to talk about later in the presentation. But I did want to call attention to that some of these terms like maximum out of pocket and deductible, while we are going to describe them in the presentation, you know, Gina has total fluency with this kind of thing, as do our assisters, and I just don't want to take for granted that, you know, this can be really overwhelming for a lot of people, a lot of Vermonters, and this assister program is for you. You know, it's available to you. You know, there's no charge associated with it for most assisters, and you know, we want people to use this program, and these resources are at your disposal. So we can't promise you that you'll get Gina, but we do have fantastic assisters throughout the state who can help you and are trained in the same exact way as Gina. So I just wanted to kind of put another plug in to just make sure that everyone knows how accessible this is for them.
Yeah, that's great, Zach. And I think a reminder, I know you're great about giving the reminders for the questions too, Zach, but also if anybody has you know, questions about the plan comparison tool or questions for Gina about assisters, you know, we're happy to take any and all of those. And building off what Zach said and what I think Gina referenced earlier with, you know, I think that the huge difference that the members of the assister program have made over the last, I guess we're not quite decade, but a while since the Affordable Care Act was put into place with the health insurance marketplaces. And, you know, we've had, from the household health insurance survey, we see record low numbers of uninsured Vermonters, about 97% of Vermonters having insurance. We see people at lower incomes being just as likely to be insured as people as higher income people. And I think so much of that comes from having assisters right there in the community for people who, I mean, I think it's great if people can use the website and sign up, if they can call our customer support center and sign up. But, you know, we've heard a lot of stories of people who haven't had health insurance in a decade, and it was kind of daunting about where to start. And we've heard other stories about people that had a great experience with an assister, and next thing you know, they're sending in their sister or their son or their neighbor. I don't know if you've had many of those, Gina, as far as that kind of, if you'd call them the chain enrollments or
No, I do. I have, word of mouth is huge, and I can't encourage as much as you are that assisters are amazing, and all of us, we all have the same training, we all have the same knowledge for the most part, and if there's things we need to know, we have access to be able to get the answer to the questions. But people will always say they started out the process, they looked at it, they got frustrated, and they were done. But when they come to us and they know that we're here and we can sit down and put it in terms that they can understand and show them that this is affordable and help them feel comfortable not talking over their head, but being able to relate to them, that's one of the most rewarding things. It's that frustration goes away. People build confidence that they understand their health insurance, because I'm helping them understand the health insurance as they're choosing that health insurance plan, and that they can afford it. Assisters are amazing, and all of the support we have through the health exchange, through Zach and Sean and all of the people we work with, we have a army behind us to help to get you insured and help you to stay insured.
Thanks, Gina. Appreciate that, and I agree 100%. And I'm wondering, as you talk, if there's, what kind of numbers have you seen people save? Like what, I guess due to the American Rescue Plan Act, ARPA, but in general, what kind of dollar figures are we talking about when someone comes in and didn't feel like they had control over their health insurance, or they were paying some astronomical amount of money that they felt was totally unmanageable, and then they come to you and you work with them and they get signed up with a new plan? What kind of money are we talking about?
We're talking about plans that used to cost people about $400 a month or more, being down to about $200, maybe $250. And that's a huge savings. And that's with a decent coverage. So, yeah. And people are feeling more comfortable with that. One of the first questions I ask people when we talk is, think about a number you have in your head that you feel that you can afford for health insurance. What number it will work in your budget? So as people are thinking about that, I have a good idea of where their budget's going to start to begin with. And I know where to help them, to lead them into a comfortable place with a plan that's going to be best for them. We have people with chronic conditions that use their health insurance a great deal, might need a different plan than somebody that's pretty healthy, that is active, or even professional people that would rather have a high deductible plan and pay less monthly and pay out of pocket later on if they need it. But people with chronic conditions that would rather have a higher premium and not have to pay out of pocket so much as they're utilizing their insurance through the year.
That's great, Gina. Thanks. Yeah, and that, I guess what you're seeing there, people who had been paying $400 now paying $200 and $250. That $150, $200 savings, that aligns with what actually a federal report that came out in September showed that the average Vermonter that took advantage of the additional subsidies through the American Rescue Plan were paying about $186 per month per individual, per member of the household, less than they were before. And that was actually the biggest savings in the country. A lot of the way the insurance is structured here in New York was pretty high too, but we were higher than anyone in the nation, and about 3 times the national, about 3 times what folks in New Hampshire and Massachusetts were saving. So I think that aligns with what you're seeing, and really drives home what a big difference it is for people to get those lower cost plans.
It is, and people are grateful. They truly are grateful.
So, Sean, I'm wondering, this might be a good opportunity to dive into a little about why people should be reconsidering their plan this year. Just, we've talked a lot about it. Maybe if we have time to cover some of those key terms. We do have one question that I will want to circle back to Gina on, just related to what kind of prep work people should have when they come in to meet with an assister. But I think, Gina, if you're okay to stay on with us, Sean can just kind of go into a brief explanation of some specifics around what folks should be considering and why they should be considering, and then we'll circle back at the end.
Yeah, I'm available to stay through the whole thing.
Great. Well, thanks so much, Gina. It's great.
You're
great
welcome.
having you. I appreciate that. And I think, yeah, to Zach's point here, if we flip to this next slide, it really reinforces a lot of what Gina was talking about before. Actually, I think when Gina was talking about the people you reached out to after the American Rescue Plan, who may want to change their plan or reconsider. They had that opportunity this summer, which you usually don't. Usually, when you sign up during open enrollment, that's the plan you're going to be in for the whole next year. 2021 was a little bit different, and we had a weird year in many ways. So hopefully 2022 will be a more normal year throughout the life.
There is no normal.
Back there, right? Something resembling it, whatever that is now. But really, open enrollment, from now, as we talked about, ideally till December 15th, although as we talked about, you have until January 15th. But if you decide what plan you want to be in by December 15th, you can be in that plan for the entire 12 months next year, and that's kind of cleanest and easiest. And when we talk about it's great for everybody to take a few minutes, as Gina talked about how easy it is to go to the plan comparison tool at vermonthealthconnect.gov, spend a few minutes looking to see what your current plan is, what your financial help is likely to be. Everyone should do that, but I think it's particularly important for people to do it if they meet kind of one of these four buckets we flagged. Number one is if when you enter the plan comparison tool, if you put in the number of people in your household and you put in your income level, you're going to see immediately what financial help you're going to get as far as premium assistance. Gina talked about that before, as mostly being the federal premium tax credits for many people, also getting a smaller amount of money from the state, Vermont premium assistance. And as Gina said, that's usually within that estimate's usually within a couple dollars of what you'll get, what you can deduct from any metal level plan, bronze, silver, gold, platinum. And we should have mentioned too that you can enroll in catastrophic plans as well, but you can't use financial help on those catastrophic plans. You have to also be under 30 to enroll in those plans. But I think an important message for people under 30 is definitely look at the plan comparison tool, because in many cases, unless your income is pretty high, you'll be able to buy a bronze or silver plan for less than it would cost you to buy that catastrophic plan. So you'll get more benefits, you'll get lower out-of-pocket costs, and you'll have a lower premium. So certainly want to flag that. For others, though, in addition to seeing that what your premium assistance is going to be when you enter it into the plan comparison tool, you'll also see one of these on the right-hand side. You might see that you qualify for enhanced silver with cost-sharing reductions, and there's different levels there. If you see silver 94 or silver 87, however, what that means is that if you buy a silver plan, you can get a platinum-like plan. On average, your out-of-pocket costs are only going to be 6% or 13%, respectively, on average of your total medical bill. And a platinum plan, you pay about 10% out of pocket, but you have higher premium costs with the platinum plan. So if you see that silver 87 or silver 94 and you're not already in a silver plan, that's a cue to go. You want to change to silver, and it's just a matter of which one you want to change to at that stage. Because with the American Rescue Plan and with that state financial help that Gina talked about, the most you're going to be paying for any silver plan for an individual is going to be, I think, about $8 for 2022. A little bit more if you're in a family potentially, but still under $20 and having very low out-of-pocket costs. So that's something you want to do. And again, we talk about seeing that silver 94, silver 87. You don't have to worry about the income or that federal poverty level math that we talked about. But if you're curious, it's twice the federal poverty level, which will initiate your ability to get that silver 94 or 87 plan, which you would want to get. That comes out to just under $26,000 income for an individual, $53,000 for a family of four. A second group of people who may want to consider changing plans are people who got the unemployment compensation this past year in 2021 and moved into a silver plan for that reason. As Gina talked about, if you got unemployment compensation, part of the 1-year benefits of the American Rescue Plan was that by virtue of having that unemployment compensation, no matter what your actual income is, you could take advantage of that silver 94 plan. For 2022, you'll be going back to getting financial help based on what your actual income will be. So if your income's still going to be under that $26,000 for an individual, $53,000 for a family of four, and that adjusts for families of 2, 3, 5, and so forth. If you're going to be under those levels, you'll still want to be in a silver plan. If you're going to be over those levels, you may be better off in a gold plan or a bronze plan, platinum plan, depending on what your meta level is. And again, the plan comparison tool, or talking to somebody on the phone, or talking to an assister, can really help you with those details. But that's a quick look at the plan comparison tool, and knowing that you might have moved into silver because of that benefit just this year might be a reason to look again. Thirdly, if you've had any significant change in income, that could change what your financial help is. And finally, if you've had a change in healthcare needs as well, that could be a change in what your conditions are, what your prescription needs are. As Gina was talking about earlier, somebody who doesn't expect to have a lot of healthcare needs, knowing that they might be able to get away with a higher deductible, higher maximum out of pocket, as long as they have the money set aside, or knowing how they can take care of that worst case scenario, they may well save money by being in a lower meta level. And Gina and Zach, I don't know if there's anything else related to flagging people who maybe particularly should reconsider their plan choices at this time of year that you think of that I missed.
I don't think I think you covered it well, Sean. I think I don't know if you want to kind of just touch on for 2022. I'll just put it up here. What the kind of
what's different? Yeah, absolutely. So so what's different for 2022? Versus a year ago, open enrollment. The biggest thing is the American Rescue Plan, just those really significantly different costs that Gina's been talking about. But even comparing 2022 to where we are now after the American Rescue Plan, there's going to be two big differences. Number one is that those thresholds for qualifying for financial help are going to be even higher in 2022 than they were even after the American Rescue Plan. It's for an individual, if you have an income up to $105,000, you'll be able to get some financial help. And if you're in a single plan, so if you may be in a single plan and have a spouse who's on Medicare, or something like that, that $105,000 threshold is the household income you'd want to look at. And obviously, talking to a sister, calling the customer support center, they can confirm that. But in general, that's the threshold. And for a family, somebody in a family plan, you could have an income up to nearly $300,000 and you'll still qualify for a tax credit, which, living in Vermont, not in, San Francisco or Hollywood or wherever it is, not a whole lot of families I know who are making more than that. So if you know of families who are signed up directly through the insurance carriers, Blue Cross or MVP, we know those insurance companies have been reaching out, sending letters to their customers who are signed up, because if you're direct enrolled, you can't get these premium tax credits. You're going to be paying more. So you really behooves you to transfer your plan over to Vermont Health Connect. The insurance companies have been reaching out to people, but a lot of people don't always open their mail from insurance companies or mail in general. So if you know people who are direct enrolled and you think they're a family that might be earning less than $300,000, encourage them to open their mail, encourage them to talk to a sister or call the customer support center and get their plan transferred over so they can start saving these hundreds of dollars per month. And that's actually a good segue to this second bullet we flagged here. The other big difference for 2022 is that who people pay their monthly health insurance payment to is changing. For the first, 8 years of the health insurance marketplace, people have been paying Vermont Health Connect, and then Vermont Health Connect takes their premium payment and sends it to MVP or to Blue Cross or to Northeast Delta Dental, starting with their first payment for 2022, which will be the bill that people get in mid-December for their January 2022 coverage. They're going to be paying the insurance company directly. And that's something I think we're excited about, and I referenced it as a segue here for people who are direct enrolled for a couple of reasons. I think as Gina talked about, and as everyone knows who wasn't living under a rock in 2013 and 2014, those early bumps in the road, many of them had to do with paying premiums and paying bills and having them get to Vermont Health Connect and getting to the insurance company, and the way all of those computer systems talked together. Many times they've related to to the bill paying and that extra step. And so when people had the opportunity to enroll directly with insurance company, many people did and said, that time they weren't qualifying for subsidies, and thought better to just work directly with the insurance company. But now with those two big changes, one with the American Rescue Plan having a lot more money available for lower costs for people with much higher incomes, number one, and number two, now having the opportunity to pay the insurance company directly each month, not have any potential for hiccups there. It really takes away any reason to not enroll through Vermont Health Connect and get those lower costs.
Thanks, Sean, for overviewing that. And I know we're short on time, so I wanted to come back to something that we alluded to before, which is, and actually Gina alluded to, which was figuring out, and I think you did too, Sean, figuring out how to find a plan that is right for your budget, and the maximum out of pocket or out of pocket maximum is something that I think I just want to bring to everyone's attention and shouldn't be overlooked, because it's on that plan comparison tool estimator when you go in, and you can really see how much you're going to have to pay in a good year, an average year, or a bad year. Before the American Rescue Plan, before the Affordable Care Act, you could really rack up the bills very quickly. And now going through Vermont Health Connect, the plans all have these out-of-pocket maximums. So, you have this graphic on the right. It's probably higher. These figures are probably higher because, as you can see, this was from 2014, but healthcare costs can add up really fast, and without health insurance and an out-of-pocket maximum, that number gets really kind of difficult to manage very quickly. I just took a couple plans here to show for examples, but you can see these are some Silver 77 plans from both of the carriers on the exchange, and these have out-of-pocket maximums that are far lower than even that one cost of the broken arm was in that graphic on the right. So that means that your out-of-pocket costs are capped at that out-of-pocket number. So just by having health insurance, that total cost of your premiums and your out-of-pocket expenses stops at that number, which I think is just really important for people to understand, because that worry of financially being totally, bankrupted by your health insurance costs, your health insurance bills can be eliminated by having health insurance. So, your
healthcare bills. Yeah. And I think that's really powerful, Zach. And I think, as you pointed out there, the comparison of the number on the right, potential healthcare costs, and then the protection with the maximum out of pocket. I think it's also important to drive home that likely, if just something like a broken arm, you're not likely to hit your maximum out of pocket on that. So that really isn't the comparison point. I think your maximum out of pocket is going to be more that longer hospital stay or some of those, really big numbers. But even knowing that maximum out of pocket is helpful to think about going in, and helpful to think about what your worst case scenario could be, which, if you don't have health insurance, you can't even fathom the worst case scenario, because it's going to be a bigger number than any of us will ever see. So having a worst case scenario that still seems like a lot of money. I mean, we're not trying to sugarcoat anything here. Paying that maximum out of pocket as an unexpected cost is not something that's going to be easy for anyone to do, but certainly compared to the alternative, it is better. And also, to not get too scared by the maximum out of pocket, I think it's important, as Gina was noting earlier too. It's great that plan comparison tool has the deductible and has the maximum out of pocket right up front. If you click and dig a little bit deeper, clicking on one of those blue names there, the MVP, Vermont Plus, Silver, 177 or the Blue Cross one, you get some more details right there, and it's going to tell you if somebody of your age and health status, kind of what the probability of someone like you having a good, quote unquote good year, quote unquote average year, quote unquote bad year. And for most people, that quote unquote bad year is going to be a 2 or 3% chance. So it's not something to get overly anxious about, but it's good to be prepared for that worst case scenario.
Yeah, thanks for that clarification, Sean. Definitely, right. As you can see in this graphic here, it's much lower percentage chance in the single digits that you're going to have a bad year, and so the maximum cost is definitely not the most likely. And thank you also, Sean, for the clarification about the health insurance bill versus your medical bill. So by paying your health insurance, you will reduce your medical bills, not your health insurance bills. But so I was thinking, Gina, maybe we can kind of end with a question because we're out of time here. But the one question that I wanted to get your way was, if someone is going in to see an assister, what kinds of things should they prepare? What kinds of information and material do they need to have on hand? Should they plan to bring? Is this something you'll talk about with them beforehand? Just kind of thinking ahead to, okay, I'm ready to see an assister. What do I need to do to be most prepared?
So one of the first things that I do, usually if I'm making contact with somebody, is by phone, and I will do a quick screening with their permission over the phone about their financials. And we kind of have to look into a crystal ball a little bit, because everything is based for 2022 on your income for 2022. But don't be afraid of that, because we can always call and we can report changes of our income anytime during the year so that everything is reported accurately. So we look at what their household gross income is. So it's not just the individual who is obtaining health insurance. If it's just one person in the household, it's the whole household that we're looking at, and that would be the gross income, not what you're living off of, but what you're actually being paid. Social Security is considered income to be reported. So if you're on Social Security disability, or you've got a family member that's on Social Security and the spouse is not ready for Social Security yet, we do have to have that information on the Social Security income. From that, we ask the questions about your health. Are you on a lot of medications? Are you looking at having any kind of procedures in the coming year? Are you planning on knee surgery, hip surgery, all of those kind of things? Talk about what you do when you're not working, what you do for play. Those are the things that I ask people to talk to me about and share with me to be able to help choose a great plan. The other thing that I know I said earlier was, before they come in to sit with me, I will ask them, think about a number, take a look at your budget, and think about a number that would be affordable for you for health insurance. And of course, a lot of people are going to say nothing. But then when they sit and they look and they think about it, they'll come back and they will actually have a number. And surprisingly, we can get pretty close to that number that people think they can afford.
That's great, Gina.
Yeah, thanks, Gina. Really helpful, and and as you can see, assisters will kind of help you go from there and point you in the right direction and get you enrolled if that's the direction you choose. So I think that should probably wrap up our town hall for today. Sean and Gina, thank you so much for joining us as usual, and to all of our attendees, thank you for joining. Please feel free to share this widely. We will have another set of town halls later in open enrollment period, one in December and one in January. So you can check out our website and our social media posts for more information on those. We'll go more into detail on plan selection and kind of do one more last push at the end of open enrollment to see if anyone needs additional information on getting insured through Vermont Health Connect. So
can I just say one thing?
Please.
don't be afraid. Call us. We can help you make that decision. Whether you decide you want health insurance or not, you'd be surprised, you probably will, but we're here to help you. Let us help you calm any of the fears or calm any of the confusion that you have to be able to set you with the right thing and help you understand what you're enrolling into. And we also help take away the frustration.
That's great. Thanks. Yeah, thanks so much, Gina. We've heard that from so many people. People love the assisters. We love the assisters too. And yeah, your point there, I mean, we've seen with the household survey, the vast majority, there's only a couple % of Vermonters that don't have health insurance, but of those who don't, they usually say cost is the reason. So that's really powerful to hear you say that once you have that conversation and people get at ease and you ask them a number that would be affordable, that you can usually find something that meets that now. So I think that's just wonderful news and is really going to help us think together with having folks like you and the other assisters out there combined with these additional benefits from the American Rescue Plan really help us cover even more Vermonters than ever before. So thank you for all you do.
And thank you for doing this.
Absolutely.
All right. Thanks. Thank you. Thank you both again. Again, this will be recorded, has been recorded, and will be posted online. So feel free to share widely. It should be on our website within the next day or so. Thank you again to our presenters, and until next time, take care and happy holidays.
Happy holidays. Stay safe and well.